It is important to remember the disorder names with respect to the systems. First, we'll see cardiovascular disorders. Hypertension, angina pectoris, cardiac asthma, all this comes under into cardiovascular disorders. Now we'll see endocrine and metabolical disorders. Most popular is diabetes. Type 1 diabetes is insulin dependent, where beta cells stopped producing insulin. Type 2 diabetes, non-insulin dependent. It creates the insulin but not utilized properly in the body. The symptoms are polyuria, polydipsia, hunger, weight loss, gangrene. Hypoglycemia is also called lower blood sugar. Hyperglycemia, which refer to higher blood sugar. Gestational diabetes to the woman when there is pregnancy. Thyroid, T3 hormone, which is triiodothyronine, T4 hormone, thyroxine. What is hyperthyroid? T4 secretion is more, which is also called Graves' diseases. Thyroiditis, also called Hashimoto's disease, also referred as autoimmune disease. Endocrinial and metabolical disorders. If the BMI less than 18.5, which is called underweight, between 18.5 to 24.9 normal, between 25 to 29.9 is overweight, more than 30 is obesity. Main disorder name is metabolic syndrome, in which abdominal obesity, high BP and high blood sugar, also dyslipidemia. Normal sugar levels are in between 70 mg to 100 mg. Obstetrics and gynecological disorders. Dysmenorrhea, the problem during periods, vomiting sensations, diarrhea, fainting sensation, chest pain. The problem causes endometriosis, adenomyosis and uterus fibrosis. Obstetrics and gynecological disorders continue. The menopause and premenopause, in which monthly period stops, estrogen production decreases. During pregnancy, the first trimester, woman has to take more folic acid, that is vitamin B9. Go for the quad screen test for any baby development or growth. Next, gastrointestinal disorders. Typically, it's called gastritis, in which abdominal pain, nausea, vomiting sensation, bloating and heartburn. The H. pylori is main root cause for most of the problems. One more disorder is indigestion. It's also called dyspepsia. Continuation of gastrointestinal disorders. Peptic ulcer, gastric esophageal duodenal ulcer. Again, reason is H. pylori, frequent usage of aspirin medicines, consumption of alcohol and smoking. Constipation, difficulty in final evacuation is constipation, which is in different ways: idiopathic, normal transit and slow transit. Diarrhea, take ORS and zinc supplements, which helps. Irritable bowel syndrome, IBS, food flow is very slow, which forms gas. Next, colitis, large intestine issue, also called Crohn's disease, fistula. Hermoids, piles, hermoidectomy, the process of removing the piles with the surgical process. Now, muscular skeleton disorders, back pain, intervertebral disc prolapse, IBDP, Cauda equino syndrome, arthritis. In the arthritis are osteoarthritis, rheumatoid arthritis, gouty arthritis. In the spine, cervical 7, thoracic 12, lumbar 5, sacrum and coccyx. 26 in adult, 33 in children. Different spine positions, the kyphosis, lordosis, scoliosis. Neurological disorders, which is very common in women. Generally, it remains at one side of the brain. Headache and tension. Epilepsy is also called seizures, which happens in the center nervous system, CNS. In the young children, it called as febrile convulsions. Different kinds of seizures are there: petit mal seizures, grand mal seizures, single focal seizures, partial complex seizures. The medicines also mentioned. Psychiatric disorders, anxiety, generalized anxiety disorder, panic disorder, phobias, agoraphobia, social phobia, pathophobia, claustrophobia, aclophobia. In the depression, autism, anorexia nervosa, bulimia nervosa, and the binge eating. Respiratory disorders, sinusitis, chronic bronchitis, bronchial asthma, chronic obstruction pulmonary disease, COPD, emphysema, cystic fibrosis, pneumonia. Allergic rhinitis is also called hay fever, which causes from plants and flowers. Acute bronchitis leads to chronic bronchitis, which leads to COPD. Spirometry is the test to observe the severity of the respiratory problem.